Hello, I'm Virginia Lewis-Fuentes and I'm one of the cardiologists at the Royal Vet College. I'm going to talk in this next session about approach to the cat with respiratory distress due to heart failure. The first problem is recognising that you're actually dealing with congestive heart failure, and when faced with a cat with respiratory distress, it's important that you make some correct decisions early on in your approach. So things that we can do to increase our chance of identifying correctly congestive heart failure is to watch the breathing pattern, listen to the chest, both the lungs and to the heart sounds, and then imaging can be helpful in confirming our suspicion that we're dealing with congestive heart failure. What is really important is that we don't stress these cats. A cat presenting with respiratory distress is very fragile, and we can easily push them over the edge by causing them too much stress in how we restrain them. So above all, we want to adopt a minimal restraint technique for anything we do with them. The first step may be simply to provide oxygen, and if you have an oxygen cage, that's a good way of allowing the cat to relax, to avoid stressing them while delivering increased concentrations of oxygen. Even holding a circuit, delivering oxygen close to the face using a flow-by technique can be helpful as long as we're not restraining the cat unduly. For some cats, they may be so distressed about their breathing difficulties that you have to consider sedation, and in these cats we usually prefer to give butorphanol. Often it's not possible to give it intravenously in the first instance, and so we give it intramuscularly. That can give the cat a little bit of a chance to relax, and while we're waiting for it to work, we can watch the breathing pattern. We need to pay attention to the respiratory rate, to the amount of effort being used in breathing, and whether there's any audible noise. Generally, with acute heart failure, congestive heart failure, there won't be any audible sound produced by the cat. Generally, when we hear noise associated with breathing, it's upper airway obstruction. So watching this cat here, you can see that the signs are not that dramatic, but when you watch closely, you can see the cat is breathing with more effort and breathing faster than normal. And these signs are very easily missed by owners, and if the cat is moving around, it's easy for you to miss these signs too. So you need to watch very closely at the rate and pattern of breathing, how much effort is being made by the cat. We can use auscultation as well, and cats with a rapid respiratory rate, increased effort, and audible inspiratory crackles, we should be very suspicious about the possibility of pulmonary edema. If we can't hear breath sounds very well ventrally, but we can hear them dorsally, then you should consider the possibility of a pleural effusion. If you have a cat presenting with a rapid respiratory rate, the main causes will be pulmonary parenchymal disease or pleural disease. And in both of those categories, congestive heart failure is a very important differential. So for any cat presenting with tachypnea, we should consider the possibility of it being congestive heart failure. If we hear abnormalities of the heart sounds while we're examining the cat with tachypnea, so if there's a murmur or an arrhythmia or a gallop, then we should consider even more strongly the possibility of congestive heart failure. So it could be that we have congestive failure and cardiomyopathy or congenital disease, but don't forget the secondary causes, and we should include hypothyroidism and anemia, for example. And then don't forget that respiratory disease, particularly airway disease, is quite common in cats, and we know that murmurs are quite common in cats. So just because you hear a heart murmur doesn't always mean that you must be dealing with a cardiac cause of the respiratory distress.